when you cough, you may think for a second, coronavirus, even a sneeze, could this be COVID-19? The symptoms are general for the most part, similar to other viruses. But what exactly should we be looking for and what should we be doing? Here to help break down your questions, Dr. Anna Maria Temple. She's been practicing medicine for nearly 2 decades and has a social media following that is fairly steady. Thank you so much for being with us today.
So great to be here.
Okay, so our first question here is, a lot of people may think, like we were talking about, a cough, a sneeze. What exactly should you be looking for? Because let's be real, it is spring. You're going to have allergies. It's also flu season. This could be a myriad of other things and may not exactly be coronavirus.
It is so confusing. I totally agree with you. Probably the easiest thing is that if you have spring allergies, you have itchy eyes, runny nose, itchy nose, and that's really the one that can tell you it's allergies. But the coronavirus, the top 3 symptoms that we can say for sure are going to be fevers, and generally high fever, a dry cough, and shortness of breath. Other than that, it becomes really confusing because you can have fever. Some people may have a little sore throat. Some people may sneeze. Some people have a tickle in their throat. Some people have a little belly discomfort because it's not 100%. Those top 3, the fever, dry cough, and shortness of breath, are the top 3 that we can associate with coronavirus, but it is confusing.
It is, and now not necessarily because of community transmission. You don't have to have traveled to Italy or to China to be in that group for potentially testing. So the question is, do you run to the ER or do you first have to call a doctor and make sure you call ahead?
Well, we still don't have tests for everybody. They're still going to triage you, which means they're going to try to figure out if they're going to test you or hold off. So it is best to call your doctor to see if you should get tested. And it all depends also on each area, because every state and every city has different amount of tests available. So if you have a fever and a cough and shortness of breath, please call your doctor. You are of the more likely candidate to be tested. If you have other symptoms and concern, always please speak with your doctor so you can rest assured one way or the other.
And if you have these mild symptoms, you're home, there's been a lot of talk about Ibuprofen versus Tylenol. A lot of people saying it's a myth. It's not a myth. We don't really know for sure. What's your take on this? Should you leave the Advil aside during this whole epidemic?
You know, the studies are, well, the information is coming from the British Medical Journal that the scientists are having a discussion based on what's going on in Europe, and they are saying caution when taking ibuprofen and having COVID-19, just like they said, have caution with ibuprofen during the H1N1 pandemic. So the takeaway from this, do we know for sure that ibuprofen is making everything worse? No. But we do know that taking ibuprofen and acetaminophen during this illness can decrease your immune system's response to the illness. So we just need to be cautious. Always speak with your doctor, but be careful. We are panicked. We are worried. Everyone's taking their temperatures all the time. So if you have a temperature of like 99.6, don't run for the ibuprofen or the acetaminophen. See what the body needs before you run for all these over-the-counter medications.
Yeah, that's some good advice. And you specialize in pediatrics, and as more people get tested, we're seeing that more children are now testing positive. In Ohio, a 2-year-old testing positive. Here in our area, we're seeing 8-, 9-year-olds also testing positive. Again, debunking the myth, fact or fiction. Are children more susceptible than we originally thought to this virus?
The children, initially, well, we knew children were getting it. The great news is that there have not been any pediatric deaths at this time. I just checked my latest updates because, the information is changing minute by minute. But as of 4 days ago, we have not seen pediatric deaths in ages 0 to 9. That doesn't mean that they're not getting symptoms. And mild symptoms are referred to as high fever, cough, shortness of breath, even pneumonia if you don't get hospitalized. So children are susceptible to getting this. They're getting milder symptoms overall, and they're also easier to transmit. So it seems that this virus is sparing the children. We're trying to understand the mechanisms behind it, but they are not spared.
Yeah, and that's also some good news that no infant-related deaths or pediatric deaths. Also, a lot of comparison, the flu versus COVID-19, influenza versus coronavirus. You look at the flu, we finally have a flu vaccine. You look at coronavirus, there's no vaccine for this, and it could be months, maybe even a year before we see that. Can you briefly talk about the process? Because it's hard to understand that something that we know so much about now, and also, of course, know so little about, can take so long before we can vaccinate against it.
Gosh, it is so complex because there are 4 different kinds of vaccines that could be on the market, and they're also trying to figure out what is going to mount an immune response. What is going to mount an immune response without giving you COVID-19? What is going to mount an immune response and not have horrible side effects? It is a huge amount of pressure on the people making vaccines in a pandemic because they're trying to make it go quicker, but we got to be aware that there's side effects and what is effective. And because the virus has only been around since December of 2019, we still don't have all the information on the virus in order to get the best plan for a vaccine. So I know there's a lot of studies underway. They're trying a lot of things, but if we're going to be real about it, it looks like we are months, if not longer, away from a vaccine at this time.
And the cool word now is hydroxychloroquine, which a lot of people don't even know what that means, but it's the one word we keep hearing about, the FDA trying to find some sort of antiviral that'll be able to attack this. It's an anti-malaria drug, but some people say the side effects from this could be worse than the actual treatment. Is there hope that this may be the miracle drug?
Well, that we're looking at folks in China to see where they are because they are moving forward with all different kinds of medications. And this one is actually looking pretty promising. They have the latest that I read was a consensus from the Chinese medical team saying that they did find that in some people, this medication can work in decreasing severity of pneumonia and ARDS in patients. The French scientists are also published some papers talking about this and that they're really hopeful because they've looked at this medication for other illnesses in coronavirus, in other animals, let's say, or in other SARS that we've had before. So they're hopeful that they're finding something that may work, but you're right, everything has side effects and every human responds differently. So at this point in time, there's no blanket statement that this is it, that we found it. It's just another promising medication that is out there to help those that are critically ill.
And Dr. Temple, before we let you go, what can people do at home to try and stay healthy? Obviously, social distance, isolate, stay home. But is there something that we should be eating? Is there anything that can help boost our immune system while we wait? Because we could be in this for the long run.
We could be this on the long run. And what I say to my patients all the time, I'm like, we are blessed with this body and we're blessed with an immune system that knows what to do and how to fight this. We have to choose to empower our immune system to fight properly. We have to choose to eat fruits and vegetables, which are full of vitamins and minerals. Like everybody is choosing processed foods that are chemically made by man. And then they're choosing vitamins that are chemically made by man. And then they're wondering like, oh, why are we not better? Choose fruits and vegetables and whole foods, eggs and meats as organic as possible, as fresh as possible. And that was going to be the best thing, that how we can feed our immune system with vitamins and minerals from Mother Nature. We need to sleep at night because when we go to sleep is when the immune system actually wakes up and does the fighting for us. We have to turn off our electronic devices and our social media, though we are awesome, I'm not gonna lie, but we're gonna have to turn it off a little bit because it is increasing our cortisol levels. It is stressing us out, and the higher the cortisol, the higher the stress, the lower the immune response. People put down the sugar and the sugar drinks, the sodas and the fruit juices, because sugar can block your immune system from working well for up to 5 hours. Alcohol, in a time of panic and anxiety, we like to drink alcohol to feel better, but alcohol turns to sugar, to keep it real simple. And then that's going to dampen our immune system for 5 hours and other side effects of that. And also try to enjoy your children. It is so stressful, but we're blessed with this time. We can't go to school. We can't go to work. We don't have 1,000 activities. And let's focus on what we can control, which will help decrease our anxiety, rather on all this other stuff that we have no control over.
You are a wealth of knowledge. You know, they say not all heroes wear capes. In this case, you guys wear white robes, and we thank you all for all your help in this time, because what would we be without the doctors? Thank you so much, Dr. Temple.
So appreciate it.